it is a little after 3, so let's go ahead and get started. I would like to welcome you. This is going to be the same kind of format, I believe, that we had the very first time we met, and that is that, well, no, maybe even then we had an agenda. We don't have any speakers or topics focused for today. This is your opportunity to drive the agenda for our conversation today, which in my experience, our members have no trouble doing. So please don't be shy. What's on your mind? What would you like to ask? What would you like to hear about? And because there are still quite a few of you on the call, I'd appreciate it if you would raise your hand and we will call on you. Nancy.
So we are just preparing now to go back to face-to-face in-home services, probably starting sometime in July. My question to the group is, anybody currently providing in-home VRT or community mobility? And if you are, what kind of PPE, what kind of personal protection equipment are you using when somebody is going into the home for a non-medical but very close training with somebody who is blind or visually impaired?
Jacqueline.
I can answer that. Oh no, I'm here. Sorry, I was just muted.
Okay, good.
So I can at least start the discussion on that, because we resumed opening 2 services this week, starting primarily with center-based services, but we have been slowly initiating some home-based services as well. So we based a lot of our recommendations off of, we're in Wisconsin, so the Wisconsin Department of Health Services provided a lot of guidance around home visiting. Now, yes, it was geared towards medical professionals. However, I think in many cases, like you said, due to the close contact, we're looking to follow many of those same recommendations. So for PPE for our providers, providers are wearing masks and gloves. We're not requiring gloves for in-clinic, but we are strongly recommending them for home-based services. The masks, we were actually able to get our hands on KN95 masks as well. So those are certainly closer to medical quality masks, so offer a lot of additional protection to our providers. The other piece that we're doing is that we're being really careful in regards to screening. So obviously we're doing screening with staff, but then we're also doing screening with any clients if they're coming in for services prior to entering the building. But if we're going to do a home visit prior to us going to their home, and if there is any other individual in the home as well, we are doing a screening with that person, assuming they're going to be in any sort of proximity to our provider. The participants in the training will wear masks for the duration. We'll have them wash hands before starting. We are going to ask them, if we know the space where the training is going to occur, to sanitize that, but we know there'll be some limitations in people's ability to do that. So we'll be prepared to sanitize any workspace as well prior to starting us doing any of the training. I think that's at least the primary pieces in terms of the steps that we're taking.
Great, thank you, Jacqueline. Janice. Janice, you need to unmute yourself. Oh, there, I've unmuted you. Go ahead, Janice.
Can you hear me?
Yes, we can.
Okay, I'm sorry, I'm having issues with the audio. I just wanted to add to that, because I mean, we're following the CDC and we're doing all those things too at Lighthouse, but we have discovered a little gem of an idea in case you need to touch something quickly and briefly and you don't want to use a glove because they are harder to come by. Believe it or not, if you use the little poop bags that people use for picking up after their puppies when they're going for walks, that is a great barrier. If you just need to, say, do a quick hand over hand or and you're teaching gestures on a smartphone or device, or if you just need to touch something quickly and be able to just discard quickly. So it's inexpensive. It's a lot cheaper than gloves, and a lot easier to come by than gloves. So I'm just throwing it out there in case y'all want to give it a try.
Thank you.
You got to get creative in these times, right?
Yeah. Anybody else have some suggestions, response for in-person services, how you are doing it or how you think you're going to be doing it? Any tips?
This is Deanna Rosenbaum from the Carroll Center. We are hoping to start community and limited face-to-face services even on our campus in the next couple of weeks. So I'm just waiting for final approval, but the board did create a COVID form for clients to be completed on clients and signed about whether they had it been tested for it or been exposed. And then also a document that outlines all the precautions the Carroll Center is taking as when they provide services and training, that the client has to also sign to acknowledge that they understand everything that we're doing in terms of, PPE, using masks, social distancing, sanitizing, etc. So the hope is that mobility staff will be able to begin mobility instruction out in the community, preferably outdoor instruction, but some limited in-home instruction. In Massachusetts, the nursing homes, senior facilities assisted are still on lockdown, so we won't be visiting anybody there. Group homes are still closed on lockdown. And then for face-to-face at the Carroll Center, possibly limited, like a low vision training session or a limited personal management, like cooking class or something, is being explored. So client just coming to campus for an hour or two to get a lesson. You're mute, Lee.
Thank you, Dina. Danny, would you mind sharing what you wrote in the chat about scheduling folks, etc.?
Sure. Am I unmuted?
Yeah, you're good. We can hear you.
So we have a script that we're doing with folks when we schedule, and we're calling them also the day before to confirm that they're still symptom-free. We are telling them that they are limited to having one person, if they need an assistant with them when they come here. We're telling them we would prefer that they have one person present maximum, also during their lesson, and that it is our expectation that we are able to do the health screening on everybody present, so the participant and their caregiver or friend or family support system. We've given each of our in-home service providers a thermometer, like a no-touch thermometer, and they have access to a light wand, a UV light wand, so that they can sanitize things. They all have wipes, disinfecting wipes, so that they can sanitize the area they're working in. And then we also have, we're calling them hazmat suits, but they're like disposable gowns. We have boot covers that go up to the knee. We have masks for our staff, either the cloth masks or the KN95 masks. We have masks that we're taking out to the lesson, so that if we get someplace and someone doesn't have one, that we're providing those even in the home. Kind of the things everybody's doing. We're taking gloves. We're not wearing them as a rule, but we will always have them so that if there's any question of a need for gloving, everybody has hand sanitizer to take everywhere we go. We tried to think of every possible thing that a person might need. The other thing that we did was we got our service providers these rolling carts. And so it's got a pop-up handle, and you can put all your materials inside of it, and you can use it as a seat while you're in a lesson. And it can be wiped off when you get out to the car before you pop it in the car. And that way service providers will always have an untouched area to sit. The other thing that we've done is we've gotten a really large light box, a UV light box for our clinic. so that when service providers bring materials back, they can pop it in the UV box and it sanitizes in 15 minutes, which hopefully cuts down on staff time from cleaning everything. Even their shoes will fit in there. Cell phones will fit in there.
Oh, that's pretty awesome. Everybody needs that.
Our staff are going to start wearing scrubs, the ones that choose to, so that they have clothing that's a little bit more washable. They can wash it here when they come back to the agency in the ADL apartment, so they don't have to worry about taking anything home, if that's what their preference is.
Yeah, good idea.
We're just trying to be really, really, you know, like, what do we need? What's going to be the easiest to clean?
They're all good thoughts.
So far, people are pretty receptive to scheduling. Today's really been our first day of getting on the phones and trying to book folks up. Our state will not let us work with any of our seniors. So we're working with only like the VR caseload, not our senior caseload.
Okay, good. Thank you, Danny.
Sure.
And is anybody getting their state to pay for all this extra?
There's a good question.
We got a Ready for Business grant, even though this is Sharon at World Services for the Blind. We got a Ready for Business grant, Nancy, through the state of Arkansas, but there's several foundations that are out there that are focused specifically on COVID relief. And we've got about $90,000 in grants to keep us up and operational, to pay for the extra supplies. In fact, we're to the point now where I have so much money left over from that we're putting on our front and back entrances. We're putting on no-touch doors that are automatic openers.
That's great.
I should be so lucky.
Yeah.
Most of y'all started off a lot better than mine did, though, so.
Lee, yeah. So in Massachusetts, Nancy, we are advocating the commission to acquire at least masks for clients, but the Carroll Center does supply the commission with canes for clients. So there is some money that we can do that, but I think the consumers themselves are mounting a movement to get the actually there's a big movement just to get the governor to hand out masks to people.
Good. So Kathy Mullen, would you like to ask your question to the whole group that you put in chat?
Sure. We're just hearing in Kentucky that we need to have waivers signed before we can go into homes so that the families and or our providers, if they do happen to get sick, that they will not hold VIPs and our insurance company responsible for their illness. And I'm just wondering if you all are having any of that same legal pushback or liability pushback.
Anyone care to respond? It's an important question.
This is Nancy in New York City. Our insurance company always asks for it, and our lawyer says it doesn't hold up in court, that anybody can sue for any reason, whether they've signed a waiver or not. So it may be a deterrent, but it isn't necessarily a protection.
That's what I understand too from other situations, but that piece of it being a deterrent is attractive.
Yeah.
That you are knowledgeable before the service is resumed. Thank you, Nancy.
I'm going to take this moment to promote the workshop that we have next week. We are launching an executive leadership pathway series, and it will be on a variety of subjects meant for the leadership team of your organization. We will first begin with a pretty practical returning to the workplace segment, and Insperity is going to be providing that. and we'll be talking about mostly employment-related issues, employer-related issues, I mean. And so the other part of that insurance liability question is regarding employees returning to the workplace around COVID. And so they are going to be addressing that. So that's same time, same place next week. And I encourage you or someone from your teams to attend that as well. We have the information there in the chat if you want to click on that. You do need to register for that if you're interested in it.
Yeah, just to clarify, it is not it's not replacing this call.
No, but
it is on Wednesday at 3 o'clock.
Oh, sorry,
Eastern,
Wednesday, yeah.
and you do have to register for it.
Thank you, Ben.
Yes, ma'am.
So what else?
We had another comment come in. Ann Silly, she had, you already addressed getting home visits, and if anybody has any additional information about federal state approval and payment for teleservices, she's interested in that. And then we had another comment. I'm not sure who this one came in from. It says it's from me in the chat, but it's not me. She says, we will be reallocating some of the money we saved on staff transportation and not paying staff while off, as well as vacancy management towards the COVID-19 additional costs. In addition, our government funder has announced that any unspent funds owing from 2019-2020 funding year can be applied to COVID-related costs in 2021.
Wow.
It would be worthwhile asking your state funders if unspent funds from last fiscal could be applied this way. Who said that?
Yeah,
Wendy, it's Deborah. I did, and I don't know why.
It's because you accessed through my link. Hi, Deborah.
Yeah, I saw that Sharon was also Ben Lee for a few minutes.
Yeah.
Oh, really?
So some of us are other people, but we're not. Just good friends.
I could only hope I could be as good as Ben. Come on.
Or me as good as Wendy.
Right?
I can. You can actually rename yourself in your browser. But
yes, I can, but I actually didn't know where I could find myself in this blackboard of names.
I see. I'm going to do it now.
For those who still want to be Ben Lay, please, by all means, continue.
Thanks, Wendy. Yeah, that's what I was saying. Is we are applying for a United Way. The federal government here in Canada has announced 11 point something million to United Way to open up as a fund for nonprofits to apply for COVID related expenses. A little bit challenging because the reporting requirements are arduous, to say the least. It's every 3 weeks reporting on output. But there's probably other opportunities in the States through United Way as well. But in addition to that, I was just saying that we're looking at unspent dollars during the time of the closure and reallocating those as well. Yes, our funder has announced that dollars we would normally have to return, any surplus from our government funder, we can apply to COVID-19 related expenses in this fiscal year, but they have to be spent by the end of March of 21.
Nancy Miller says they've tried to put pressure on New York State Commission for the Blind to pay for PPEs and they have refused.
So I think it would be, we're still trying to figure out at Vision Serve Alliance through our public policy committee what else that we should be advocating for in the best interests of our service providers. So this is certainly one of them. We need to gather a list of these things. I think we're probably going to attempt as a first step to have a conversation with Mark Schwartz at RSA and see if we can't convince him how important flexibility on some of these things are. Really concerned for some of our organizations. There's just who are only service providers, don't have other sources of income or enterprises, that you're not going to be able to earn your full contract value with all of these challenges. So I'm just putting that out there. If you would please let me or Paul Schrader at Vision Serve Alliance know through an email. It can be very simple. Those concerns that you have that are specifically related to RSA funds and government funds, that you lack of the ability to earn the contract, flexibility, can we move it over to the next year, PPE, there's additional expenses, those kinds of things would be helpful. So what else? Nobody responded to that comment or question from Erin Lauritsen about, anybody have policies, procedures written as to how you will handle if someone does test positive, either on staff or clients once you return to the workplace? How you'll handle it? No? Oh boy. Sounds like something we better write.
It's Deborah. We are reviewing existing policies and procedures right now for the writing of that.
Okay.
So we're doing our research, scooping from everywhere, and then we'll be writing that. I think it's going to vary, and the policy will shift depending on the contact that the staff member had, if it was a staff member. So if this is an office-based staff member that's interacting with other office-based staff, that's a different situation than someone who's not seeing any other staff but has gone to a client and then tests positive. Because some of our staff members live in their homes and then go out into the community and won't be coming to the office. That's going to be the new way. So then the policy needs to be different. I don't need to shut down the office if they've never come into the office. So that's how we're looking at it, is separating the in-home service from the in-office teaching.
Yeah, good. Good suggestion.
Lots of ouches in New York State.
Jacqueline, are you applauding or do you?
No, I'm sorry. I meant to raise my hand. Sorry. I can't find the raise hand. So it got your attention though. Yeah, I got your attention at least.
You did.
I just wanted to make a comment, and I believe this came up in one of the previous calls around conducting a staff survey. And I wanted to say that I think I mentioned earlier that this was our first week of doing some very light reopening. And so we've sent out a survey to staff today to start collecting some input. And I was very impressed with the fact that staff really appreciated that we were actively seeking their input and responded very, very positively to the survey. So it was a really simple survey. All it asked is what went well this week, what didn't go so well this week, or where there are opportunities for some improvement, and then just a space for them to put in any other comments. So there's only 3 questions. It's anonymous. And we have almost over a third, almost a half of our staff that's already responded. And the responses have been really positive. So I would just encourage other agencies to look to do something the same. I think it really allows staff members to feel like they have a voice and a space to be able to provide that feedback and input.
That is a terrific suggestion, Jacqueline. Thank you for saying that. It's okay that we don't have all the answers to how to deal with this, but super important to be honest, transparent, and seeking input from the rest of your team. And I encourage you to take that same attitude with those you serve, with your clients.
Hi, Lee. This is James Michaels at Bosma Enterprises in Indianapolis.
Hi, James.
Hi. I've been trying to find the raise hand thing. I could not find it, so I was raising my hand here in the office.
Okay.
Wasn't working out. But yeah, we're going to start with our center-based clients next week at half capacity, and we're going to stagger the breaks and lunches. And so we have, a minimal number of folks in the break room at any given time. We usually do 1-hour lessons. We have 6 classes a day at our center. So what we've decided we're going to do is we're going to have more block schedules, like 3 2-hour sessions instead of 1-hour sessions for 6 hours. So with these 2-hour sessions, we'll go 1 hour and 45 minutes and then give 15 minutes for cleaning and sanitizing the areas. So we felt like that was one way to do things. And then the other thing that we're doing is we're going to continue with some of the virtual training for the individuals who were coming to our center, but they're more in the high risk categories.
That sounds great. You know, a lot of choices. As much as you can accommodate different needs, I think the more successful you will be. And just FYI, I was trying to find the raise hand to tell you where it is myself, and I don't know if it's on here. Isn't it usually you hover over participants and it pops up? I don't see it. Oh, Erin's got her hand up. Erin, how did you find that?
I was just going to say embrace the keyboard and press Alt-Y or Option-Y if you're on a Mac, because
Alt-Y.
That hasn't changed.
Oh, why, thank you.
Okay, great. Thank you.
So I'll try it now.
Am I raising my hand?
No, you're not. So I'm not sure. Okay, who else? I saw an interesting comment in here. Let me see if I can find it again. Wendy, do you say anything that we should point out?
Danny Moran is asking about this survey for staff to be able to share how are things. I'm sorry, Danny, you might want to explain what you're meaning.
I just didn't catch the name of the survey that we could use where we can ask our team, how are things, what could we do better? I love that idea. And I love that it was anonymous so people can really do their feedback.
Yeah. Yeah, I think that's good too.
But I don't remember what it was called.
I think they just made it up. That was you, Jacqueline, right?
Yeah, I will post a link to, it's just a Google Forms. I just created it as Google Forms so it would be accessible for our screen reader staff. And I can just throw a link to it in the chat. And please just don't fill it out because that will really confuse me. But you're welcome to see the survey that we've created.
Everything is awesome. That's always my answer.
Well, I guess you can pad the survey for us if you want to answer that, but
great.
I'll pull that now and I'll put it in the chat.
Yeah. Dina, you had a, oh, I'm sorry.
No, go ahead.
I was going to say, Dina, you had a question about for those offering summer programs, any comments on funding structure?
For those who are converting to a remote program where normally remote has not been in our contracts or outline of services.
This is Nancy in New York City. We just spent the last month renegotiating every one of those outcomes for summer programs to go from in-person to remote. And we just had to negotiate what the payment would be. It was like starting from square one. Fortunately, they are going to pay us, but they're paying us much less than what they would pay us if we were providing it in person.
Yeah, Nancy, I did just have to redo our contract with New York as well. So I asked about remote training and I had to submit that as a separate thing. And I actually have to email them because I haven't heard back. But some states have said to me, oh, our approved remote training rate is X, like $50 an hour or something. Right. But I just didn't know if other people could share if they had any other experiences, because as you guys just said, like you have to get the PPE and et cetera. And so maybe you're not paying housing, but you're providing all this oversight and, extra staff to kind of do these things. And if you're doing limited face-to-face, like having a nurse to take temps if that's what you're implementing. So there is extra cost to doing all this.
And so for us at WSB, I know we're a little bit different than the rest of you who are providing either residential or like Nancy and those of you who are providing center-based, but we are currently working with 8 different states to engage in a virtual platform for vocational pre-ETs and college prep training with 8 different states. So there's a need out there.
Thank you. So you can continue. If you have any response to Dina, please add that in the chat.
Thank
And
you.
I'm going to call on Brooks Harkin.
Yes. So thanks, Lee. First off, I just want to say every time I'm on one of these calls, I think of something else that I need to add. I, in combination with everything that people have sent out, created a safety plan that I presented to our leadership team this week. But one thing that we didn't think of was what to do if a staff member or a client contracts COVID. So that's something I will be working on adding in. But and Lee, please correct me if this is something to discuss on next week's call, which I just registered for. One concern that we're having as a leadership team is how to navigate honesty within the team of travel or disclosure of maybe what you're doing outside of the office environment. I wasn't sure if anyone had any insight on that. For instance, are you asking someone who travels to maybe a high-risk area or via aircraft or something to disclose that information to staff? Or at least, right now I have it as my direct supervisor. Personally, I feel it should be disclosed to all staff, especially if you're maybe in contact with another staff member or in a small closed setting. But I just wondered if anyone had any feedback or thoughts on that, or if maybe I should hold that question until next week. I'm happy to do so.
We don't have to hold. If it doesn't come up next week, let's ask Insperity to see what guidance HR firms like them have for that point. But I think it is a concern. I remember it being discussed just as this was breaking, when people were still traveling and trying to decide, should I or shouldn't I? So I think it's a very interesting point. Any response from the group?
Yeah, we were in that meeting and we did discuss that, and we did make it reportable to human resources that staff should disclose that, and then there were additional restrictions on travel. You know, at the time there was no travel to New York City area because that was exploding with cases, and no travel outside of, I think, you know, the county or something like that. But we did ask that people report it. I can say, and I know that, you know, every state is different. I was just talking with another nonprofit agency here today, and they were kind of trying to figure out some of their reopening plans. Look, in New York, if somebody is diagnosed as positive, the whole contact tracing thing goes into effect. So, you know, asking staff to be on that honor system is really important, because people are going to find out if they weren't anyway. God forbid somebody does become positive and then it's spread to somebody else. That apparatus, which is the contact tracing system set up by New York Department of Health, is going to come into effect anyway. You know what I mean? So it just kind of behooves people to be, you know, working for the health and safety of everybody on the team and have that, you know, honesty as a policy.
That's right. That's a real good point. Thank you, Elizabeth. Anne, how do you say your last name, Anne?
Celia.
Celia.
Yeah. So we didn't actually implement it, but we had started developing a policy before we just went to remote completely. But it would just have required people that were out of state or went to high risk areas, whatever the travel you wanted to set it at, would just have an automatic work from home for the 2 weeks. So it wasn't not allowing people to travel. It was just saying, if you do, you can't do in-person services or be in the office.
Yeah, there's an option. Deborah.
Yeah, that's the same thing. That'll be what we'll be doing. I wanted to say that the travel question is going to be part of screening for staff when we do reopen, which is soon in the next few weeks. When we reestablish, I shouldn't say reopen, we've been open the whole time. When we reestablish in-person service. So I think it's a part of every screening questionnaire you see in Canada for staff and for clients. Have you traveled? It varies sometimes. Usually it'll say, have you traveled in the past 2 weeks? And it's no longer specific. It can be within the country. It doesn't have to be outside of the country. And we had a doctor, it may have made the international news, I don't know if it did, New Brunswick's a province. They had no cases, and this physician traveled to Quebec, which is a higher number of count province, back to New Brunswick, didn't declare, began seeing patients, and now there's 160 people infected in New Brunswick because this doctor came back with COVID, started seeing patients right away. So however many he saw before he stopped, and however many people they contacted, it's now the count is at 160 traced back to him. So I think it's so important, a really great lesson for us. I don't think there's smaller stuff, there's not going to be an ethical question. As soon as someone has traveled, it's going to be known anyway. But so yeah, that's what we'll be doing. They'll have to self-isolate if they've been traveling.
Thank you. So, what else? Terry.
Thanks, Lee. So I just have a quick question. If we're asking people to, self-identify, they've been out of the area. So there's two questions. Number one, what if we're back to doing direct services and now they can't do direct services, so everything can't really be done remotely from home? And then the second question is, will we also ask everyone who's present in the home when you're going to visit, when you're doing a home visit, if they've been out of the area?
So again, it's Deborah again. We have province-wide testing for all now. Depending on what your state has decided around COVID-19 testing, you can create a policy around the frequency of testing for all staff and maybe specific testing upon return from travel. And that way you cover knowing whether positive or negative. We also have here, just before they decided that we had enough tests to get anyone tested who wants to be tested at any time and at any frequency, we have that now in Ontario. But before that, we had what many of you may have, which is a healthcare worker priority on the testing. So you need to access that, call yourselves healthcare workers, explain what you do, and get ahead of the line for a test. So that's the other way to deal with that.
So Ben asked an interesting question in chat. I think we're still presuming that people who are asymptomatic can be contagious. And so shouldn't we be treating all of our clients as potentially COVID-19 positive? Dina?
So on the form, what we call our COVID screening questionnaire for clients, we do ask if anyone in their household has experienced symptoms in the past 14 days, like cough, difficulty breathing, fever, chills, etc. And if anybody has been had to quarantine, and if the client has been in contact with anybody who's tested positive or suspected of COVID, and if they have any reason to believe that they might have COVID. And the other thing, I think we are also asking that if we go into a home, we are asking other family members to wear masks as well if we're there for a lesson.
So are you asking everyone, Dina, or just people within 6 feet of?
We're asking everyone in the house. I think we're asking everyone in the household unless they're isolated, like in a closed room. But if somebody's sitting in the living room, we're asking them to wear a mask if you're working with them, in the kitchen or something.
Okay, thank you.
Thank you.
Laura Park-Leach also asked, how do we know which areas are officially high-risk areas?
I think your state lists those. Aren't they listing them on websites, which are high-risk communities? Our state is anyway.
Yeah, I don't know the answer to that question.
Well, Lee, it's Deborah again. Part of the issue isn't really whether it's a high-risk area or not, and if you can find that out, it's great. But there's also the fact that if people are will begin to get on airplanes again, it may not matter if they're traveling from a high-risk area. The rules really should be applied to everyone. Travel is a risk. It's an elevated risk. Put the travel question on the screening questionnaire that people have to answer however often you decide. I mean, even if it's a Monday because it was the weekend and they could have gone somewhere for the weekend to another state, etc. So yeah, lots of great questions, man.
Yep, who would have thunk 6 months ago that dealing with our field could get this much more interesting? What else? Well, while we have a small lull, I will mention that one of my favorite television shows at night with my husband now is the series that highlights all these beautiful little towns across Canada called Still Standing with the stand-up comedian Johnny Harris. It's awesome. I highly recommend it. It's available through Prime Video. It's funny, lighthearted, and you learn a ton about Canadian history and First Nation peoples and really cool stuff.
I did not know about that. Thanks, Lee.
Oh, you're kidding. You know that?
Go on my list.
Yeah, it's great.
I'm a Canadian who didn't know about the Canadian show.
Okay,
I mean, if you want to watch a really good Canadian sitcom from the early 2000s, you can watch Corner Gas, held in Saskatchewan.
Corner Gas?
Yeah.
Okay, awesome. I'll add it to my list. Brooks
And
has
there's always Schitt's Creek on
yes,
Netflix, which
yes.
most people have heard of. That's also Canadian.
Love that too. Brooks, did you have a question or were you applauding?
Well, one, I was applauding because Schitt's Creek's one of my favorite shows. So, great. But no, I did have a question, and again, I could have missed this. I did just have to answer a call if someone said this. Has anyone mentioned about sharing this publicly of what they're doing, whether they're listing it on their website, sending it out to their client-based clients, or their constituents, or something along those lines? We are thinking of sharing our safety plan once the leadership team approves and we send it, we submit to the board on our website, but I wasn't sure if anyone had been sending that out to anyone, like clients coming to the building or instructors or anything like that.
Jacqueline, would you like to respond?
Sure. So we did not share our entire safety plan, but we did send out an email blast to everyone who was on our email contact list last week and did some highlights of kind of some of the safety precautions that we're taking. So we didn't go into every nitty-gritty detail, but we did take that opportunity just to let them know about some of the precautions that we were taking and to give them at least some idea of some of the enhanced sanitation and measures around PPE. And we got a good response. We actually had several individuals who responded back to us and thanked us for sharing that information.
Jacqueline, was that for clients, or was that for your entire database, like donors or anyone?
We send it out to everyone. We put it out to everyone. We have a constant contact management system for our email. So it went out to everyone who was on that constant contact list.
I think that's good customer service. I would encourage you to do it. You know, and maybe putting it on your website too, Brooks, because for people who are thinking about accessing services, I'm sure that would matter to them. So we're getting close to the end here. We have time for probably one or two more questions, and then I want to change the subject a little bit and ask you to think about our fall conference. But is there anything else you'd like to share, or another question, concern? Okay, then I'm going to go ahead and change the subject. So we are still trying to decide what we're going to do in the fall, but it's looking increasingly like it will be a challenge for us to have an in-person conference. As much as we hate thinking about not seeing all of you for an entire year, it's possible that that will happen. And so if that happens, we are going to have the coolest virtual conference put on yet in our field, right, Ben?
Oh yeah, absolutely. Tireless day and night struggle to make it the best virtual event you have attended.
Yeah. So to that end, I want to ask those of you, especially program managers, what topics would you like us to consider conducting as virtual sessions? And also think if you would be willing to conduct lead a virtual session. We got a lot of, it seems like there's still many people who enjoyed the OST type sessions we had in the Atlanta conference. If you weren't there, what that meant is we determined the agenda and the topics of many of our breakout sessions, of all the breakout sessions, right that very first morning. So we're considering reserving several sessions for that kind of format too, which would then be facilitated by you, our members, our participants, and completely member driven. But we're also entertaining topics that we could have others, experts or panels present on, and we'd love to have your suggestion. And I hope you would consider participating in a virtual session if we're not able to all gather in person.
I think Lee, by then it would be really interested to have some panels on the success and pitfalls of the remote learning and instruction that people have done, and then maybe even something different for residential rehab, assuming people reopened in the fall. What is different or what has changed, or in even community services?
Well,
So.
we can save ourselves an email here. Wendy and/or I were going to reach out to those of you who were going to provide the residential services panel in spring to see if you would be willing to do that during fall.
Yeah, sure.
And just like you said, Dina, what's different, what's new, how are we moving forward with this? So you, Sharon, Nancy, that would be great. Yeah, and of course, MSU, the NRTC, is earnestly now collecting data on what they're calling promising practices in the delivery of vision rehabilitation via remote services. So they will definitely have, if not one, at least one, they may have multiple sessions on that subject for us.
This is Nancy. I listened to the AFB presentation on the accessibility survey, and I think that would be really interesting if they have a second set of data.
Yeah, absolutely. Flattening accessibility. Yeah, I was on it too. And we're participating in that. So definitely an update on that. It was very interesting and somewhat heartbreaking to hear some of those responses.
Yes.
Does everybody know what we're talking about? You were probably asked to share that with your consumers, but AFB and a large consortium of organizations, including IRA and others, sent out a survey to consumers to try to learn how COVID-19 is affecting daily life. And it's good data, and they're continuing to build on that. That, if you didn't hear it and you're interested, it will be available probably in a week or so on AFB's website. All of their virtual conference sessions are available for free. And if you didn't hear the others, I encourage you to listen to them as well. They're all good stuff. Okay, well, you know, nothing wrong with finishing a little bit early. right? Everybody could use an extra 8 minutes in their day. So I will thank you for joining us. And please keep those questions and suggestions coming. Let us know how we can help you. And if you have any fabulous resources that we can share with the other members, please send those to us as well. Thank you and have a great weekend. Bye, everybody.
Thanks, Lee.
Bye.
And again, I'm putting some resource links in the chat there for the Executive Pathways call next week, for accessing any of the information from this call in the Google Drive. And if you want to join the Summer Programs Facebook group, please join in the discussion. There's been some good posts this week from there.
Okay, and I just see Kirby from Hadley offering to present during the conference. Let's not forget them. Good.
Yes.
Thanks.